Hi, my name is Shane Chapman. I'm the chair of the Department of Dermatology at Dartmouth-Hitchcock Medical Center. Yeah, I would give patients a healthy dose of reassurance. Dermatology is open at Heater Road. We're safe, it's clean, it's safe to come in, and we'll take care of you if you have an urgent issue, if you have a medication refill, if you just need to talk to a dermatologist. You know, a lot of what we deal with is skin cancer related, causes a lot of anxiety. And along with COVID comes a lot of anxiety, but we're here to take care of you, and our clinic is open. We want you to wash your hands. We want you to be safe, but you probably shouldn't wash your hands with Clorox. That does happen. Hot water can be very drying, so tap water is best, not hot. And brushing is unnecessary. So a lot of patients will be very vigorous with hot water, soap, and brushing, and it ends up breaking down their hands. So if you have hand dermatitis, which a lot of people have texted me photographs and shown me their hand dermatitis, best to wash your hands, but not vigorously, and use a moisturizer afterwards. One of the big changes over the last 4 weeks is that we've switched our practice from an in-person outpatient clinic to 90% of our visits now are telehealth or teledermatology, as we say. We see about 4,000 patients a month, about 1,300 per week, and all of those patients were transferred to telehealth in some fashion, and we're seeing about 300 patients a week now with teledermatology, mostly our own patients and some outside referrals. And I don't think this is going to change. I think this will be the new normal and the future of dermatology, as well as a lot of outpatient care to take care of a lot of medication management issues, things that can be done with video alone rather than an in-person visit. We're learning as we go along, and yes, we are using teledermatology to screen patients. There are some patients that are sick, perhaps elderly, immunocompromised, and we may not want them to come in the clinic. So we actually like to screen those patients to make sure that they really need to come in the clinic before they do. We also have patients who may have rashes or skin cancer that they want a first diagnosis on, and we can do that with telehealth. It's a little tricky with skin cancer, but we're getting better and better at it. I think we'll have a combination going forward of about 75% in-person visits, biopsies, and taking care of skin cancer and things like that, and roughly about 25% teledermatology visits or remote visits for medication management. Patients who drive 3 hours in a snowstorm might want to stay home, and we can just manage it with telehealth or teledermatology. Children, a lot of people have children, and kids will be upset. You may not get out of school anymore because we can do this remotely, after school hours and things like that. So now that we've figured it out and the technology's there, the reimbursement's there, insurance is paying for these visits, I think that will continue. I think for certain types of visits, especially when we know the patient, we know the diagnosis, and they know us and they see our face and they trust it, we'll do those visits remotely.